You have to evaluate the existing denture first. Ask the patient if they're happy with the appearance of the denture. Do they want to change the shade, the mold, midline, incisal edge position, or occlusal plan? The aesthetic of final dentures can be adjusted based on the patient's preference. Ask the patient if the patient is comfortable with the denture. Does the denture stay in place on its own? Do they need to use denture adhesive? Evaluate in the mouth. Are the denture supporting tissue healthy? Does the denture have good stability and retention? Is the border in the correct position? If the border is overextended, trim it back. If the border is too short, prepare to perform border molding with heavy body PVS impression material on the denture first, then take the final impression. If the general fit is okay, you can use light body PVS impression material to do the final impression. If the overall fit is poor, consider using medium body PVS impression material for the final impression. Medium body material helps fill a bigger gap between the denture and supporting tissue. Light body PVS is better for thin layer of impression or for patching small area. Check whether the current video is correct. When the patient is relaxed, measure the VDR. Then let the patient bite down to measure VDO. At the correct VDO, the difference between VDO and VDR should be around 2 to 4 mm. You can also use the measure from the corner of the eye to the corner of the lips to help find out the correct VDO. Also, let the patient pronounce M and S sound. Mississippi. For S sound, there should be no contact between the posterior teeth. The maxillary and mandibular incisors should be very close together but not touching. When the patient pronounces the M sound, the mandibular teeth should not contact the maxillary teeth. The jaw is at VDR. Correct pronunciation of S and M sound typically indicate proper VDO. Over time, as dentures are worn, ridge resorption often occurs, which can lead to collapsed VDO. It is uncommon for the VDO to be too large. If the VDO needs to be increased, there are 3 ways to adjust it. 1. During the impression stage, by making the impression thicker. 2. Taking bite registration with increased VDO. You can let the patient bite down at centric relation to the desired VDO preset on Easton measure. 3. During the denture setup time, by instructing the lab to open the bite to the desired vertical dimension. Ask the patient, are you comfortable with the bite? Does the bite feel even on both sides? Do the denture or jaw shift when you bite down? Check whether the patient's most stable bite position is in centric relation. If the patient can easily bite into centric relation, you can use that position during the impression stage and scan the upper and lower jaw relationship as centric. If the centric relation does not match the patient's natural or stable bite position, you should record the centric relation using the bite registration material and then scan the upper-lower jaw relationship after impression. If the ridge resorption is too severe and the existing denture is severely worn, it can affect multiple key factors, including aesthetics, fit, video, and centric relation. When all of these factors are significantly off, it becomes difficult to use the existing denture for records. In such cases, you should not use the duplicate denture workflow. Instead, use the Easton complete denture workflow to collect all necessary records will be easier.